morning, Indian women in Dubai. Girls, this is Rima, live from Zivanza Clinic in Healthcare City. Can you please say a quick hello if you can see me, if I'm audible, I'm visible? Hey, hi Rituja, thank you for joining. I am joined today by two very special doctors here. We are going to be talking more about mental health, about psychiatry, because we have amazing specialists here. My first guest today is Dr. Satish from Bangalore, who's traveled all the way from India to be here for the next 2 days. My second guest here is something which IWD is very familiar with. We've spoken to her before, Dr. Tulika from the Zivanza Clinic. Before I move on, I'm going to welcome both of these and I will let them do their own introductions and talk about them. And wow, hi Sanjeevni, hey Megha, thank you girls, hold on, and if you have any questions, we're going to keep it a very open session, so please feel free to ask any questions you may have. So I'm going to hand it over to Dr. Tulika for a quick introduction. Okay.
Hello everyone, hello Indian women in Dubai. And today we are introducing a very special guest, Dr. Satish, who has joined us from India at our clinic and is going to be a visiting consultant at our clinic. He's available on 13th and 14th of this month, and you all can come and talk to him about any mental health issues that you have. I'm already here at Zivanza, and if you have any issues and you want to discuss about mental health concerns, you can contact the front desk and we can take it up. So I'm a psychiatrist here, and I'd like Dr. Satish to introduce himself further.
Great.
And talk to us about his specialities.
Yes. There you go. Can you
Yes.
the camera is okay?
Yes, I think so. Hello everyone. Hi, good morning to women in Dubai, Indian women particularly. I was quite surprised with the sheer number of women on
Yes,
the group.
we've got more
And-
than 40,000.
Great, that's great. And hello to everyone, good morning, and thank you for warm welcome I received here at Zivanza Clinic by everyone here, very lovely people, and also for Rima for connecting with you all. So I'm Dr. Satish Ramaiah. I'm basically from Bangalore. I did my graduation in Bangalore, then spent about 12 years in the UK, did all my super specialty training in psychiatry and sleep disorders, worked as a consultant for a few years, went back to India, set up a psychiatric hospital called Marga in Bangalore. It's a super specialty psychiatric hospital with state-of-the-art facility for inpatient, outpatient care and everything. And then we connected with Japneet, connected with me at Zivanza, and I'm here in Dubai now for the first clinic this weekend, 13th and 14th. I'm a psychiatrist by super specialty, and also I've done sleep disorder specialization. So I'd be happy to help in any way needed for any kind of mental health issues, for adult psychiatry or someone suffering from any kind of anxiety, depression, or some serious psychiatric illnesses like psychosis, bipolar, and things like that. Substance misuse disorders, sleep disorders, or any sexual medicine issues, or even old age related problems. Dr. Tulika is already here at Zivanza full time, so you can always contact her. So I'll be visiting now and then, and this weekend I'm available. If anyone want to avail my services, I'm happy to help. Thank you.
Lovely. Great. We have a lot of people watching us. Girls, is this audible? Can I get a quick yes and a hello? Good morning to all of you. Oh, hi Supriya. Hi Mona. Hello Swati. Amazing. We have a lot of guests. This is an open session. If you have any questions, please do type in the comments below. Dr. Satish is here for the next 2 days, and thanks to Mr. Japneet from Zivanza, we have 50% off all consultations for the next 2 days. So please book your appointments. I have a few questions for these specialist doctors, and my first one to you is, what are the most common mental health issues or problems for which patients should be coming to you?
Great. So mental health problems, as we know, is quite commoner than what we think actually, and many people may not even realize that they might be going through mental health issues. So how common is it? It's very common. And statistics say that probably 1 in 4 in the world at some point in their life do suffer from some form of mental illness. So all the mood changes we go through on a daily basis, the ups and downs of emotions, the way we think, behave, is it all mental illness? Probably no. Yes, it's quite normal for us to go through all the fluctuations on a day-to-day basis, react to certain situations. But what is mental illness? Mental illness is when people go through some abnormality in the thinking, or the feeling, or behavior, or the way they function or relate to other people for adequate duration of time and also severe enough to impact their functioning in some ways, either the personal life, the professional life, or any other aspect of their functioning. So very common ones are probably people going through mood fluctuations, like feeling a little depressed, clinical depression, or anxiety disorders, or even other neurotic conditions like OCD, obsessive compulsive disorders, or some people may have gone through some trauma related issues, stress related issues, or sometimes the people can go through some serious psychiatric conditions where they lose touch with reality, experience some perceptions which are not there, and have false beliefs. We call them psychosis, as part of some clinical conditions like schizophrenia or bipolar and things like that. So it's not just the working age adult or adult population that go through mental illness. Even children can go through a lot of mental illnesses. Children can go through issues related to their development, as part of their emotional development, or physical or motor, cognitive, behavioral, and so on. And that will have a larger impact on the family functioning as well. So children can go through their own set of mental health issues, including the ones that adults go through, adult as well. And other than that, a lot of behavioral mental disorders like substance misuse disorders, people getting addicted to certain substances, are in the new age addiction of internet addiction, gambling, and so on as well. And of course we have mental illnesses secondary to some physical health conditions. Sometimes people may have been going through some personality related issues. Yes, personality disorders is a very tricky term, so we don't know we need to call it a disorder or not, but some people may have certain vulnerabilities which may start affecting their functioning. Old age related problems as well. People have going through cognitive issues, memory issues as a result, having a lot of behavioral problems and all. So yeah, that's an overview of what kind of mental illnesses people can go through. The most common ones probably is the anxiety and depression kind of issues.
Right. Let me just check the comments. Veenaji, thank you so much for joining us there. We have a question. Should I address it to you, Dr. Tulika? So Sanjeevani is asking, it's difficult to understand kids sometimes. How do we understand if they lack concentration or they don't remember their own responsibility? And she's not sure if she's asking the right question. But what is your take on kids and when we should be concerned versus normal kids?
Yes, so I think parenting, like I have always said, is a very complicated process, and you're always second guessing yourself whether you're doing the right thing or not. And parents today, sometimes you read so many things, you're like, am I a helicopter parent, or am I a neglectful parent, and all these things. So most of the time what I tell everybody is that your parenting is always in a normal range, but you can always do better.
Mm-hmm.
So you can learn better techniques.
Mm-hmm.
So when you're saying that the children are not listening to you, you have to make a communication with your child. Your relationship with your child has to be based on communication and appreciation, rather than on obedience and rules.
Yeah.
So that is a very brief the gist of what your parenting should be about. But then if you are having specific parenting related issues, sometimes there can be, like they said, concentration difficulties. Yes. There can be ADHD. There can be ODD, oppositional behavior. Like children are trying to get autonomy. So that time there can be behaviors where, even when there is no reason, they are being oppositional, that I will not listen to anybody. They are going through a phase. So if the child is facing any such issues, it is always good to speak to a specialist about it, get a little bit of parenting guidance, get a little bit of clarity on where things are going wrong, and everything can be in place. So,
great. Dr. Satish, do you have anything to add to it, or are we good?
I think Dr. Tulika has covered it quite well in terms of both parenting and also from the children's point of view. So it's always important to kind of put yourself in the child's shoes and see why the kid might be behaving the way they're behaving in the context of maybe their personality or the developmental stage they're in, their understanding, perception, and things like that. That will always help the parents and the clinicians to advise things in the right way. So that's the only thing I want to add. Yeah.
Lovely. I hope that answers your question, Sanjeevani. Feel free to write below if you haven't. Let me just look. We have another question there. I'll address it to you, Dr. Satish. Is it possible to have a complete recovery of the basic depressions or neurotic issues or psychosis? And this is from Supriya Chauhan. Thank you, Supriya, for that question.
Hi Supriya, I think that's a very good question. So complete recovery, I think we need to be clear in terms of what we really mean by complete recovery. I think in mental health treatment, what we aim for is for the person to get back to their original level of functioning as much as possible. Of course, all of us will have our own vulnerabilities as much as our strengths. That we carry it all our lives. We can't completely get rid of our vulnerabilities. Wherever it has come from, it may have come from our genes, our upbringing, our experiences in life, and so on. So it's not really about getting rid of vulnerabilities, it's about working around them and managing them in a way that it doesn't affect our functioning. So when the vulnerabilities get exposed because of whatever external triggers, people may go through mental health symptoms like anxiety, depression, like we said, sometimes psychosis and things like that. So we may not be able to completely get rid of all the symptoms, but if the person becomes very insightful into how this manifests and how it starts affecting them, and as specialists we can help them a way of managing. Sometimes we may have to through therapeutic techniques or sometimes medication or getting the family involved and see how they can create new ways of working. All these things can certainly help the person to get back to their functioning. So we try to use the word treatable, not curable in some of the psychiatric conditions, but many of them, honestly speaking, they are definitely curable as well. I've seen a lot of people going through just one episode of depression or maybe a couple of episodes and completely back to normal. But some serious psychiatric conditions, the very nature of those illnesses are relapsing and remitting in nature, which means there's a possibility that they may have relapse symptoms at some points whenever there is trigger. They don't comply with treatment and things like that, but we can still do a lot of things as a team, I'm involving the family as well here, to make sure the person get back to their functioning and also prevent the relapses as much as possible.
Lovely. Anything to add, Dr. Tulika?
Well, so whenever we talk about recovery, we also have to talk about the seriousness of the situation. So for example, in a disease like diabetes or hypertension, when you start treatment, there are many people who just with diet and lifestyle changes, they can get back to their regular level of functioning. But if your glucose levels are not getting back to normal, your blood pressure is not getting under control, you go for medication.
Yes.
You go for regular, so in very similarly in psychiatry also, in mental health conditions also, depending upon the level of difficulty the person is facing, you have to increase the treatment in a stepwise manner.
Right.
So you have to get your assessment done, understand the level of severity of the problem, what kind of treatment will help you, and you should not think, that I need medication, oh my god. No, it is about the level of problems you're facing, right? So why would you deny yourself that?
Yes.
You won't deny yourself treatment in diabetes. Why would you deny yourself treatment in depression?
Yes, absolutely. Agreed. Supriya, I hope that answers your questions. If not, I can actually, she's already saying that it answers and gives her hope and positivity. That's amazing. I saw another question from Veena ji. Veena ji is saying some seniors are in depression. How do you deal with them and how can we help them and tell them, in this situation?
Okay, so basically when you're saying some seniors are in depression, you're trying to talk about old age depression and geriatric depression. Now, the issue which most people face with geriatric depression is that there is also associated cognitive problems, memory related problems, and there can also be a lot of deficits in functioning. Their activities of daily living can also get affected, and getting them through treatment might be a problem. So what I always tell people is that you have to have a medical approach here. You have to tell them that you are going for a medical evaluation. You're going, and then you have to go on the basis of symptom. If somebody is having depression, they would be having anxiety symptoms, physical symptoms of anxiety. They would be having memory problems. They would be having sleep problems. And you have to go from there. That see, these are the problems for which you're taking treatment.
Right.
If you tell them you have a mental health diagnosis, they would feel stigmatized. So that is my approach.
Great. Comments to add, Dr. Satish?
No, I completely agree with Dr. Tulika. I think we got to look at it a little holistically and try and see what other issues a person might be going through. Yes, old age depression would be very similar to other depression occurring in other people as well. So it's about understanding the underlying issues and evaluating them and assessing and helping them in the right way. So see if you're not missing anything there, like Dr. Tulika mentioned, dementia and other things. And yes, once we establish the depression only, then we talk to the family in terms of what treatments are available. Like many times, just a psychotherapy would be good enough. We may not have to prescribe medicines in everyone. Depending on the severity, the duration and the impact, we may have to consider sometimes short-term medicines as well.
Great. Veena Auntie, I hope that answers your question. Just a quick reminder for everybody watching us. We have 50% off for the next 2 days for IWD only. So this is all for the women of our community. I'm going to leave the number of the mobile number where you can reach out and book your consultation. Dr. Satish is here in Dubai and he's available for the next 2 days to book your consultation. And I'm just going to move on to the next question. We have a lot of questions, as you can see. This is from Piyusha, and Piyusha is asking, the kids are so stressed because of peer pressure. Even if we don't want to pressurize our own kids, there's so much pressure. How do you deal with the anxiety of kids?
Right. So it depends on what age kids we are dealing with. Again, like I said earlier, depending on the children's and the ability of coping, that age of development, understanding, cognition, we try and help them. Now, first of all, let's not dismiss kids' anxiety and just telling them that it's, you are absolutely fine, nothing. Yes, all those positive reassurance is fine, but I think it's important to try and empathize with them, try and tell them, okay, tell me a little more about anxiety, listen to them carefully in terms of where is the anxiety coming from and how is it manifesting. So sometimes it can be very specific anxiety about being fearful about something specific, or I don't know, whether they're going through some academic related issues or some peer related issues and so on. So trying to understand the underlying cause and see how the anxiety might be manifesting. In kids also, like adults, it can manifest both in the form of psychological symptoms of feeling very fearful, tense, worried all the time, and a lot of negative ruminations about future or what might happen, anticipatory anxiety, and sometimes physiological changes also. They may go through nightmares, they may also go through all those palpitations and sometimes sweaty, shaky and things like that. So understanding the underlying issues and then addressing them is very important. But in kids also, if the manifestations are severe, sometimes we do provide them therapies, primarily focusing on behavioral therapy, because cognitively approaching a child might be a little challenging, and like I said, depending on the developmental age. Sometimes, very rarely, some short-term medicines may also be used. But main thing is talking to the kids, listening to them carefully, empathizing with them, and telling them, look, we understand, I know it must be difficult, but thanks for sharing, and these are the ways you can cope. So helping them some simple techniques about the reality, how the feelings could be different from the facts. Many times the emotions are driven by feelings, right? Kids might have some very irrational fears. So if you could help them with the difference between the feelings and facts, they're actually quite intelligent. We sometimes underestimate how much kids actually understand. So we actually sit them and counsel them, and with some very simple techniques and exercises we give them to cope with the anxiety, they will definitely help. Of course, as parents and teachers and all the other people around kids also should contribute and help the kids as well.
Lovely. Dr. Tulika, any comments to add?
Yes, so adolescent kids, you have to understand their brains are different from yours, okay? Number one, they have much higher risk taking than an adult. Their brains are, because see, they are coming out of the protective parental control and they are going out in the world. If they don't have that exploratory urge, they would not go out and figure out what they want. So they are biologically wired to be more risk-taking, number one. Number two, need for social approval. Again, they are coming out of their family environment and they are making their own relationships.
Yeah.
So it is actually very wired in them to be that way. Need for social approval. Everybody should like me.
Yes.
My peer should like
me. Yes.
So peer pressure and high risk taking, they are wired like that. Now keeping that in mind, it will really help you understand a lot of their behaviors.
Right.
So when you understand that this is where they are coming from, and you may think they are being completely irrational about a particular dress they want to buy and they are creating a big fuss about it, now you know where they are coming from. So then comes communication. So I think that is that's how you handle peer pressure, and explain it to them that, see, I understand where you're coming from, but then at the same time, this is quite unnecessary.
Great. Piyusha, does that answer your question? I hope it does. If it doesn't, feel free to write in the comment box and we will take it up again. I think I'll just urge all the women on this group. We are all daughters, wives, mothers, and sometimes the family might not accept, but we need to take that first step of recognizing that we need to see a doctor. We have some mental health issues in the family, and there's a lot of convincing that takes here, but we need to take care of our families. So if you feel you need to have a consultation with a psychiatrist, we have 50% off for IWD only for the next 2 days for any consultations in the psychiatry department. I'm going to leave the number on the top to book this. Make sure you make good use of it, because I think we are all responsible for our and our family's health. I'm just going to take up look at the questions. If you are watching this, I need a quick hello from you. Good morning, IWD. Everybody wake up. Anju is asking what's the clinic name and location. Can you just share it once so that people can know where to come?
We are here right next to Wafi Mall. We are in the Wafi residence office, and you'll see a blue board saying Zivanza Millennium Medical Center. So we are right here, and you can go on our website. The location is there, and we can share it on the roof also.
I'm also going to share it.
So just put Millennium Medical Center Dubai, and you'll get it on the roof.
If you search for Zivanza Millennium Medical Center, it's right next to Wafi Mall in the healthcare city. I'm also going to share the phone number to call if you want an appointment, and we will share the location on the top of it. Just looking at the comments again, Veena ji is asking, I'm a brand ambassador of Senior Citizens Bliss Community. This will helpful a lot. Absolutely, Veena auntie. And Veena auntie, if you want to organize a one-to-one session for senior citizens, addressed for senior citizens only, I'm sure Dr. Tulika, Mr. Japneet would be very helpful. So I'm happy to connect you to the clinic. We have a question, and this is from a new mom, and I know Margie has a little baby, and she has a question. How do you deal with postpartum depression? Dr. Satish.
Hi. So yeah, postpartum depression is quite common, and we think most women, probably about 70% of women, would go through what we call postnatal blues, which is having minor mood fluctuations post-delivery for a few days, maybe some irritability, getting a little emotional or not able to sleep well. These things are extremely common, and they generally ease out on their own without any active treatment with the family support and everything. But however, in some women, it can go on for a little longer. The symptoms of depression which we normally see in personal depression would be very similar in postpartum depression, where a mother post-delivery would go through feeling very low in mood. Sometimes, it would affect their energy, their motivation, their concentration, their ability to enjoy, including the ability to enjoy the motherhood, which is a very blissful time, but they're not able to enjoy. In fact, they might feel very little disconnected with kids, with the babies many times, which is very painful for the families also to see, and for the mother also. And they may also get into a lot of negative ruminations about themselves or the baby or the future, feeling hopeless and things like that. Many times it can reach a stage when they may even think, what's the point in living, kind of thing, suicidal thoughts and things like that. So it can be very painful because it's a celebratory mood in the home and having a new baby. But however, if the mother goes through this can really affect the mother and the bonding with the baby as well, which is very crucial for them, for the baby's development. So yes, if you do notice any mother who's going through these symptoms for weeks or even sometimes months, it can go for. So it's important to consult a specialist where we can assess the mother and see if there is anything else going on. Like maybe the mother was going through some kind of psychiatric condition before the delivery, some pre-existing mental illness, or any other stresses the mother is going through, or is it purely biological? We try and assess all that and then discuss about the possible treatment. The treatment would also be very similar to how we treat depression. Many times, we may not have to prescribe the medication in mothers. Of course, we bear in mind the effect of medication on the mother when they are breastfeeding. So we don't want the baby to get affected. But having said that, there are a lot of safer medicines available these days where we can prescribe medicines in a breastfeeding mother also. Psychotherapy is the primary treatment where we help the mother to cope with the negative thoughts, emotions through various techniques and skills and strategies, and also talk to the families about how they can help. I think family support becomes very crucial during those times, particularly the partners, husband support. So all those things we look at it very holistically, sit with the family and see how we can help. Of course, if there are risks associated with a women's depression, postpartum depression, like if they have thoughts of harming themselves or suicidal thoughts, or sometimes even unfortunately they may have thoughts about harming baby as well. So in those circumstances, they may need a brief period of admission in a hospital just to keep them safe, and then we try and help with them with the symptoms and manage the risk.
Lovely. Anything to add, Dr. Tulika?
So, in my experience, very recently I was contacted by a postpartum mother, and 4 months into her postpartum period, and the biggest challenge I think mothers face is physically coming to the clinic for treatment, because they are feeding and they are physically not that healthy to come. So in that case, we have an option of online consultations.
Okay, great.
We have an option of online therapy sessions, and we do facilitate treatment like that. So I think online therapy sessions work well actually. So in such situations, although yes, once you're stabilized, once you're physically feeling better, coming for a follow-up to the clinic is a good idea. But if you're physically not feeling that you can come, an online consultation is a good option.
Great. So I hope that answers your question, Margie. If you can come to the clinic for the next 2 days, great. If you need a one-to-one or an online consultation, please feel free to reach out to the clinic. We are live from Zivanza Clinic in Healthcare City. It's right next to Wafi Mall. So the location is very central, I think, for a lot of us living around the area. Absolutely. Just looking through my list of questions. Oh, we have a lot of questions for you guys. We have another question from Supriya. How do we convince someone for coming for consultations? And I think this was actually one of my initial questions for you. There's a lot of myths or stigma around coming to a psychiatrist. How do we get over that? How can you help? I think a lot of the mothers, the women on the group might want to bring their family members. They recognize the problem, but how can we bring them here?
Yes, so very rightly said, there is a lot of stigma around going to a psychiatrist, because people think that you go to a psychiatrist when you've completely lost your mind. That is not the case. Like Dr. Satish mentioned right in the beginning, that 1 in 4 person will go through some mental health issue during their lifetime. And if you look at the statistics, it's like this, that only 20% people who have faced depression are able to avail the services that are required and get the right treatment. Another 20% are there, they go to services but they do not get the right help. Then comes another 20%. So if you look at the 1/5 of the people are the ones who go to the right services, who get the right treatment that they deserve. Others, either due to stigma, either due to lack of services, they're not able to avail those services. So there's a big untreated depression chunk, and it affects your functioning, it affects your ability to work, it affects your relationships, it has long-term consequences on your life. So instead of thinking that going to a psychiatrist makes me weak, you have to look at it from getting the help that you deserve perspective. When you know that there is a diagnosis, when you know that there are treatments available, when you know that you can do better, why would you deny yourself that treatment? That's one thing you need to look at. So that's why going to a psychiatrist is not only for people who have completely lost their mind. That perspective, you need to let go of that idea, first of all. There is medication, there is psychotherapy, depending upon the seriousness of your problems. There is a whole lot of treatment options that are available. The doctor always discusses them with you, and then they start treatment. Number 3 is that all the medications in psychiatry, they control your mind. That's not the case. They work on neurochemicals. There is a certain so when a person is going through depression or psychosis or bipolar, there are chemical alterations in the brain, and these medications are trying to correct those chemical imbalances, and the idea is to improve your functioning, to decrease the symptoms and improve your functioning. So the medications have to be tailored. So you have to keep all these things in mind. So I'm just trying to break 2 big myths that I face in my clinical practice. I think Dr. Satish can add a lot more.
Yes.
No, great. I agree, Dr. Tulika. I think apart from what Dr. Tulika said, some of the things which I have tried, have worked in people having no insight and having a lot of stigma. First of all, let's not dismiss the stigma, right? Because stigma is real, right? And it's an experience. It could be culturally related. It could be related to the person's personality. So it may not be helpful to just go and tell the person, no, don't worry about it, and you're not going to become bad. Yes, it will help, but at the same time, you just need to somehow make them feel that it's absolutely fine to come and see a specialist. Some of the techniques I've used is, I've told them, look, it's not just about going and seeing a psychiatrist and getting into some prescription or medication and things like that. It could be just a talking session. You may understand more about what you are going through. It could be a guidance session. You might reflect on your own experiences much better when you speak to a specialist and devise your own therapy. And second thing is, many times it might be helpful, particularly for people with substance misuse disorders, where they don't want to seek insight because they don't think it's a problem. What we tell them is, let's look at it more like a system. right? Not as an individual problem. There is some issue in the family. People are not happy in the family for whatever reason. It may not be about just that person. Maybe others around that person also might be contributing knowingly or unknowingly. So let's have like a family discussion with the doctor and see what's working and what's not working in the family, in that particular system. And in the process, if everyone has to take a step back, learn something, take some ownership of making things better in the relationship, why not? And in the process, it may also involve treating a particular person with specific therapy, or it could be psychotherapy like Dr. Tulika said, or it could be medication and things like that. So rather than just telling the person you have a problem, you can call it like, we seem to have a problem in the family, something's not working here, why don't we go and get some help? That might help better, particularly with kids, teenagers. I've seen, and also couples going through some interpersonal difficulties. We always see that the one person wants to just only look at the negativity about the other person. So we might want to call it like a systemic issue that might help them to engage better with the therapist.
Thank you so much, doctors. I hope that answers your question, Supriya. Thank you so much for the amazing questions this morning, girl. I'm just conscious of time and the doctors have to get on with their appointment. Otherwise, we could continue talking all day long. I am going to, Supriya says that's very helpful. So thank you very much. I am going to leave the contact details of the clinic on the top of this live. There's a phone number which you can call, WhatsApp to book your clinics. The appointments can be booked online, or you can visit the clinic in person. It's right next to Wafi Mall in Healthcare City. And as an IWD special discount for all of us women, we have 50% off for the next 2 days only. So please make use of that amazing offer. If you have any personal feedback, if you have more questions, I'm happy to connect you to the clinic directly. Please message me or the number on the top. Thank you so much, IWD, and have a lovely day ahead.